Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about men's health, and joining me is Dr. Eric Wallace, Associate Professor, Internal Medicine, the University of Oklahoma School of Community Medicine, and OU Physicians in Tulsa. Welcome.
Well, thank you.
Now, you've been on here before, and we've talked about issues affecting women, such as breast cancer screenings, cervical cancer screenings, but today we're going to focus on men's health. Now, in general, tell me, how does the average male approach health, their health?
Right. Well, in terms of doctor visits, the average male usually will go to see the doctor when their spouse tells them to, or their significant other tells them to. See a lot of men who sort of wait till problems appear later on in life. Maybe they've been lingering for a while, but most men don't like going to the doctor very much. So what I'd like to convey to all men and all women out there, especially who are involved with men that they care about, is to have them go see the doctor, because there's a lot of health issues, especially from a preventive standpoint, that you'd like to deal with sooner than later before problems develop.
And we will get into those. But tell me, in general, why do men delay? Is it because they are afraid to go to the doctor? Or is it their pain threshold is very low? Is it just that they're so busy caring for others in the family? I mean, what are some reasons that they really just don't want to go?
Well, there's a lot of factors involved. I know as a man that I prefer not to go to the doctor if I can avoid it. So I think it's part of our nature to want to avoid the doctor at all costs. But you know, sometimes we're busy with our jobs, whether it be 1, 2, or 3 jobs. We're busy at home. Or we think that things are just going to get better on their own, and we don't want to go through the hassle and the time commitment and the cost of going to the physician.
Now, do you find that this is more culturally focused, or is it just men, regardless of the cultural background, the racial background, it tends to be a universal, I don't want to?
I think most men feel that way in general. I think there's a little bit more of that attitude skewed toward minority populations, and that's when you start adding in issues of lack of health insurance, distrust for the medical system based on the history of medical care in this country. So there are many factors that play a part in a man in particular not wanting to go see the doctor.
Okay, now when we think about women and we talk about getting a yearly exam, physical, those types of things, and I know you talked in our other segments and shows about breast cancer and cervical with some changes in screening time frames, so we won't go into that in much detail. But for men, should they think about a yearly or annual, or should it be biannually, just for a well checkup?
Absolutely. I think that men should go see their doctor on a yearly basis, just for a general checkup, to get a good, thorough physical exam, to look for things like skin cancers, to look for any worsening of symptoms, things that could lead to a cancer, heart disease, and so forth. The number 1 and 2 and 3 things that will most likely lead to a man's death, those are the things that we're looking for early on and at certain age cut points as men get older.
Okay, now when we think about then, let's say well checkup, and then we're going to talk about some symptoms and specifics. Let's say for the adolescent male, because we should be taking, of course, our young kids and that. For the adolescent, should they come as frequently as the older men, or as they get older, still yearly? Or sometimes people think where they're young, maybe every couple of years, but break it down in terms of that as well. So men who are younger, young males, should they have the same concept of the yearly, or what?
I think so, because there are certain illnesses and things that will lead to problems for men early on, things such as sexually transmitted diseases. There's a lot of young men who smoke out there, and those issues need to be addressed. Cholesterol can be another factor. There might be an early onset of diabetes or high blood pressure, especially with the prevalence of obesity these days. That leads to medical problems. So I think that, again, the earlier you intervene on some of these chronic medical problems, the longer you're going to live and the fewer problems you're going to have down the road. Okay.
Well, now, what are some of those things that may appear to be asymptomatic, or general symptoms that men need to sort of key in on to take themselves to the doctor? I mean, we think about maybe coughs, or we think about certain irritation like a burning upon urination or things like that. Tell us about some of those general things that could mean other things other than I'm just getting older, or I just was in a smoke-filled room, or where we kind of make excuses whether we're male or females, you know what I mean? We rationalize.
Exactly. So one way to approach that is think about what are the top killers among men in terms of medical diseases. And number one is going to be heart disease, and you can throw stroke in that same category too. So the things that are going to increase your risk of heart disease and stroke and so forth are going to be a few things that you can't change. Number one is your age. As you get older, that increases your risk. You also can't change your family history. So if you have a family history of early heart disease, that can also increase your risk. But the things that you can modify, number one is smoking. Right? If the worst thing you can ever do in terms of your health is to start smoking, and the best thing you can do to improve your health is to quit smoking. So that's number one. That's the number one thing I like to address with my patients. And smoking here in Oklahoma is very prevalent. And then other things that increase your risk of heart disease and stroke are going to be diabetes, hypertension, and high cholesterol.
Okay, now let me ask this about smoking, because people may say, well, I've been a smoker for years, and if I quit, so what? But does your lung function actually get restored to a certain level, lung capacity? How does that work?
Well, for people who smoke, and actually anyone in general, as you get older, your lung function will decline. So for me, I don't smoke, but as I get older, my lung function will lose some of its capacity that it had when I was at a younger age. But for smokers, the rate of decline of lung function is much greater than those who don't smoke. So when you quit smoking, it actually doesn't return your lung function to an earlier age. It just slows the worsening of that lung function. And after a certain number of years being off of cigarettes, the decline of your lung function will be similar to those who don't smoke at all.
Okay, good. So you can sort of help yourself get healthier by stop smoking. It's not like it's too late.
Absolutely.
Okay, now you talked about issues of let me ask this in terms of lung cancer and lung function. A person who has a chronic cough, therefore, or are there distinctions in different kinds of cough? They don't have a cold going, but they just seem to have this persistent cough that just never seems to go away. Are there some symptoms such as that the person needs to think about the doctor with your lungs?
Right, so when we talk about lung cancer by far and away is the number one cancer killer among men, and smoking is attributed to that such high number of cancer deaths. The things you want to look for are a cough that doesn't go away, weight loss, coughing up blood, and especially if you have any family histories of lung cancer, that might put you at a higher risk. But the fact that you smoke, and if you're having any lung symptoms whatsoever, it might be pain with taking in a deep breath. It could be, just not feeling right. You feel like there's something going on in your lungs. If your health doesn't feel like it's as good as it used to be, you definitely need to see your doctor. The problem with lung cancer, although it leads to such a high number of deaths, we don't have a good screening test for it. So there's been no evidence that us doing full body CAT scans or regular chest x-rays or any of those tests have been shown to reduce the number of deaths from lung cancer. That's the one unfortunate thing about lung cancer these days. We have no good screening tests for it, but the best way to prevent lung cancer deaths is to, number one, not smoke. Number two, if you do smoke, you need to quit.
Okay, and that we're going to take a real quick break, but that would also mean in terms of secondary smoke exposure too. So maybe the person doesn't smoke, but they're visiting casinos or places where there's always a lot of smoke.
Correct.
Same thing for them.
Absolutely. Secondhand smoke increases your risk of developing lung cancer as well.
Okay, we'll take a quick break and come back and look at another area.
Okay.
Please stay with us. We'll be right back.